It's very, like, kind of freeing, I guess. You can just see everything and you're like, wow, I feel like I'm really on top of it. And there's music playing, like the music gets louder because you're closer to the speakers and it's really cool. When you hit it, it feels so good. I pretty much just started out like all the other little kids. I took Learn to Skate with all the little kids, and it was more something that I was kind of into, so I stuck with it. When a lot of the other people were dropping out and stuff and decided they didn't like it, I was like, I think I want to do this forever. Well, when I was really young, my big goal was to go to the Olympics. My goals now are still to go to the Olympics, but hopefully with this one by my side. Pairs is a bit different. You always have to take someone else into account. Also, in pair skating, you always have kind of like a built-in best friend. So like when you're having a bad day, your partner is there to cheer you up, or when they're having a bad day, you kind of have to be there to cheer them up because you're on the same team.
Excuse me, you cheater? That was paper. We'll see that on video. That was paper.
We were going to do our free skate and we were on the 20-minute warm-up. Everything was a little bit off that day. I think I was a little tired, or like my legs weren't warm, or something was off. We were like, oh, we're gonna do our practice with the music. And I was like, okay, let's do triple. And so we were skating into it, and it was pretty good actually. Like every other throw we'd done, it's just the landing, I wasn't ready for it. It's hard to have a awareness of where you are in the air, so when you're up and you can tell it's off, you still have to like kind of rotate until you hit the ground. Even before I was like twisted, when my foot hit the ground, there was so much force that I was still rotating that when my foot hit, I was like, oh God, and I was like, oh no. I like fell and I was kind of like, well, I kind of screamed. I was like, ow, ow, and then I was like, I can't breathe, and Lachlan was like, just breathe. I was like, I can't. And then after that, he like kind of picked me up because I couldn't walk, and I was like crying because I already knew in that moment like something was wrong and we're not gonna go to that competition like in a couple weeks.
So I believe I knew of Naomi before she knew me. I have a daughter who is a figure skater, and she has met a lot of the world-class skaters that train at World Arena. And one of her favorites is this person named Naomi, and she is a pair skater. Great person, wonderful personality. Just a really high-level skater, but very down-to-earth. So as my beginner daughter skater walks in, she's made a connection with Naomi. Naomi says hello to her every day. And so that's how I knew of Naomi first. Naomi did not know me at that time. And then the injury occurred. She came in with an MRI that did show the ligament injury. She had some higher level competitions that were coming up, and we had to factor that into what our options were. We decided to go forward with the surgery.
I was really grateful for him the entire time, and he was so positive, which made me think better. I was like, well, if the guy who's doing the surgery is positive, like, why shouldn't I be? He was very careful, but also very mindful about our timeline of hoping to get back for nationals and junior worlds. When he was kind of with me the entire time, like through everything, and it was really helpful. And he was always like, he's kind of calm, which is like, if someone was too excited, it might make me a little like jittery, and if someone was too nervous, obviously that's never good. So he was like very empathetic, but also very calm.
During the surgery, part of that is an arthroscopy, which is 2 small incisions made in the anterior ankle. One portal you put a camera in, the other portal a tool. And as we're evaluating the joint, We're cleaning all the debris from the injury. And, unfortunately at that point, the MRI had not picked up a chondral injury. As I came across the injury, it is, how important it is to her, how important it is to her family, her partner. And in that split second, you just do, everything that you were trained to do. And you take care of it in the best way possible. Had to be very careful at that point. That's the most important part of the surgery. We did have to remove some part of that injured cartilage. Other areas were tacked down, so you do debride this back to a stable cartilage rim, and at that point stimulate the cells of the bone that's deep to that. So a bone marrow stimulation, either with a pick or even a small shaver. At that point, we continued with a procedure as planned. We evaluated the ligament that was damaged. We debrided the joint in between the larger bone and the smaller bone in the ankle. That's the tibia and the fibula. We were able to debride that because it was unstable. And after we had finished, debriding all the loose fragments and inflamed tissue in the ankle joint, we went on to perform the ligament reconstruction. And that went as planned. However, not all of these procedures do end up going as well as it did for Naomi. So that was the part that was difficult to see, just knowing in that instant that this could potentially be a career-ending injury. And, facing the fact that we did have the opportunity to help her, and we had the tools and the skills to do it. And we, again, took care of it as we had described, and she ended up doing very well. Once she had finished her recovery, from my standpoint, and she was working in physical therapy, there was just no stopping her. She came in and I said, "Hey, you're a little bit stiff." And she said, "Oh, what do we do about that?" And she took care of it. Just daily exercises and stretching, everything that we asked her to do, she did. And so that shows the determination and perseverance, and that's why she is where she is now, because she works hard in every aspect of her craft. Each patient is an individual. Each injury or issue is different, and throughout all of the surgeons here at Colorado Springs Orthopedic Group, we have a lot of years of experience in how to treat and diagnose and take care of people. And I think that shows your passion of getting people back to the sports that they enjoy or the activities that they enjoy, or recovering from an injury, whether minor or serious. That's what we are about here, is making people better and getting them back to their passions.
When I was standing on the podium, it was so exciting and so thrilling, and all the adrenaline, especially it was so late at night. It was just amazing, and looking up in the stands, and I saw my mom and my sister, and I was like, ah!